Thanks, Greg. Great presentation. And, lucky to be involved at one of the universities that you mentioned. But my question is, I think we touched on this earlier today to some degree. What's the scalability of this? What's the extension of this? These are a unique list of universities you showed there. How do we take it from there to sort of mainstream?
The size of the food service sector prior to the pandemic, and we'll see how it is this year, but it was around $800 billion, right, in the US. That's a big market to move. It's very costly to move that market. So we tend to focus on parts of the market where there's the greatest opportunity for innovation. One of them is what we call the fast casual commercial restaurant sector. K through 12 is an important area because we have a lift from government policy there. But another area is campus dining, college university. So we had this 15 or 16 universities involved. We have within the Menus of Change University Research Collaborative 60 universities. And this is a very unique organization because they're non-competitive, they're independently run organizations, and they can compare and share notes. And many people in the United States point their finger at somebody like McDonald's and says, you people are the problem. But the fact is that the commercial restaurant sector is not going to change if they don't see other people successfully serving food. In other words, if you can't even give away food as part of a food program where your parents paid for the thing, good luck getting people to actually, take out their money and pay for it. So we think it's incredibly important to show models of success, right? And the campus dining sector is enormously important. It's moving very quickly. The plant forward movement is, you know what's going on at Harvard and Yale. We're so lucky to have Rafi with us, who's done enormous innovation there at Yale. But again, we have to have those models where we can point to and drive change in the rest of the sector. Otherwise, it's too expensive and unpractical.
Thank you very much. Mr. Willett?
Yes, thanks. And I'd just like to add to Greg, who's really been a supercharger of this transformation and made the Mediterranean diet something that's aspirational. And I think that's actually the most important thing, that this is now recognized in the US anyway as the best, not just by nutritionists, but by, I think, the average person who does see this as something to aspire to. And talking about the campuses, you mentioned Harvard and Yale, and yes, those are good places, but actually probably one of the really best university food services, I think, has been the UMass that Ken Toon has led there. And I don't have the exact numbers, but Ken has said there actually has been a reduction in costs to the food service. It gets at the point that you made earlier. If you're careful about plant foods, they aren't all expensive. Carrots, cabbage, squash, those are actually quite inexpensive. It's tomatoes off season, yeah, those are expensive. But if you're careful, it is possible to do something that is actually less costly. And so they are producing food that is healthier, costs less, and it is incredibly popular among the students, which again goes back to doing this with taste, and it's also creating an environment that's exciting for the students and everybody. So, and most importantly, that's not an elite university. It's a good school, but it's not Harvard or Yale. And I think that addresses bringing this out in the mainstream in a very important way.
Sasan? Yeah. So out of the 60 universities that are members of MCRC, certainly we have a number of the Ivy League schools, but we also have almost the entire University of California system are members. The member that's hosting the fall conference this year is the University of North Texas. And for those of you that aren't familiar with the politics of food in the United States, Texas is a big beef state, and the University of North Texas has an entire dining hall that's vegan. So again, this is an important wedge of transformation in the United States.
Thanks, Greg, for your important notes about adding the olive oil to our food. What about thinking in the same line about adding olive leaves and olive water to take care, better care about having the phenolic of the olive oil, of the olive?
So maybe there's a future, Paul. I'm looking at you of olive oil stocks. So yeah, no, I mean, I think we need more experimentation, more research. We need to find from the scientists if that's a good idea. But I think that yeah.
Greg, I also want to commend your tremendous efforts in terms of translating nutritional sciences into practice. As you said, if the foods are not tasty, no matter how healthy they are, people are not going to follow it. And one important area I think you have done is to incorporate cultural dimensions and social acceptance into various foods and different dietary traditions. And want to say that the World Health Flavors, I think, has played a very important role in terms of integrating cultural health and environmental sustainability. I think that's something that's really important for us as well when we talk about the transferability of Mediterranean diet to other cultures and vice versa.
To better articulate some of those other models of cultural-based models of healthy eating, whether it's West Africa or Southeast Asia or India or parts of Latin America. Interestingly, I've heard from different parts of the world. I know, Walter, you heard about this from the Eat Lancet. Is that other parts of the world are, people in other parts of the world have said, what about us, right? What about our part of the world? But I think there just needs to be an articulation process there, and more, whether it's photography or how we bring that to life so that people can really see what that is. I have to say one thing that's interesting though is that I've had a number of conversations in the last 2 or 3 years with people, particularly with the run of the Mediterranean diet being voted #1 every year and so forth. That people from other parts of the world sort of resentful of the visibility of the Mediterranean diet, and I'm remembering the conversation that I had with Antonio over coffee in Athens in 1991, and because she had just made a presentation at a conference that I ran in the north of Greece, and we were totally surprised by the research on the Mediterranean diet, and you said one of the reasons that we don't know anything about the Mediterranean diet in the United States is because of the leadership of public health is largely in Northern Europe and the United States. Nobody cares about what's going on in the Mediterranean at that time. And then the issue of the fact that it was sort of a little bit fuzzy in terms of what it was and it needed to be defined and so forth. But you think about where we were 30 years ago and where we are today in terms of articulating, presenting, advancing the Mediterranean diet. We sure have a long way to go, but it's also a lesson to all of us that if you find something that's a good pathway, if you lean into it long enough, you're going to make progress. And we have to do the same thing for other parts of the world and for culturally based food models. The other thing that I think is very important is it would be very sad if the plant-forward movement was immensely successful, but it was only successful because of plant-based meat analogs, which may have a role to play, food tech, but it's not as though we're trying to invent something that's never been invented before. It exists. We just have to popularize and reimagine what's already there and make it new again, right? But unfortunately, there's so much capital pouring into food tech, which is fine, and that's great, and that can be part of the solution. but the rest of us have to work just as hard to promote these ultimately more accessible, I would argue more delicious, culturally based models for healthy eating.